In this video, I wanted to show passive range of motion of the shoulder joint after a shoulder surgery. As you can see, I'm ranging the person's shoulder in flexion, external rotation at 45 degrees of abduction, and also external rotation at 90 degrees of abduction. It's critical that you hit all aspects of the capsule in order to keep the capsule mobile after a shoulder surgery. So I'll keep doing flexion, external rotation at 45, and external rotation at 90 as a passive way of getting the shoulder joint moving. Then we'll move on to some self-range of motion that the patient can do after surgery. This is external rotation at 45 degrees of abduction. And you can see I have a towel roll under her elbow to keep her in the plane of the scapula. And we'll use the same concept when we're working on active assisted range of motion, external rotation at 90 degrees of abduction. Again, these are exercises that the patient can do at home as part of their home exercise program. Once we work on external rotation, range of motion, self-range of motion, we progress to some shoulder flexion in the supine position. I like this position because the scapulars are stabilized on the table and the patient can use the non-involved shoulder to get the shoulder moving through the full range of motion. And finally, I like to use rope and pulley. The rope and pulley is a nice way of getting the shoulder joint moving in the plane of the scapula and to try to obtain overhead mobility.